So again, this patient had a relatively short initial remission duration. That patient falls into about the 20% of patients that have early progression, but fortunately did not have evidence of histologic transformation. Nevertheless, this is still a fairly poor prognosis group, even if you take out the transformed patients. So the question here really is, what do you do? And most people, and I'd say myself, is when I see an early progression patient like this, I try to do something other than chemoimmunotherapy. So I will concede that the data are not in as to what the right answer is, but more of the same is probably not the right answer, unless maybe you're using chemotherapy as a stepping stone to something more definitive. That more definitive thing might be something like an autologous transplant, which this patient might be a bit borderline in terms of age for that. There can be very fit 69-year-olds, and age is really not a strict exclusion, but nevertheless, this patient might be in the upper limit of age for autologous transplant. If I'm not using a chemoimmunotherapy approach, I would typically try to do something that's different. And thankfully now we do have some other options that are different. One is lenalidomide rituximab combination. Now that has been shown in a comparative trial to rituximab alone, showing a significant benefit in progression-free survival. Now, the major caveat to that data is that that was a rituximab sensitive patient population. And this patient is not rituximab sensitive, progressed on rituximab maintenance. And I think we would expect our results to be inferior than what was seen in the AUGMENT study for this reason. Other approved agents include ibritumumab texacan. This is a radioimmunoconjugate, a single infusion for patients that have low bone marrow involvement, and also can be quite effective and very low toxicity, particularly for older patients in the second line. I really try to think about clinical trials for these patients, however, and this is the exact patient that I would refer to a major center for clinical trials.